Hi, everyone. Welcome to another episode of The Link, a collaboration between APLA Health and Pyro Media Network with funding from the CDC, a show where we talk about we love new graphics. So this is a show where we talk about basically whatever we want. When we say whatever we want, though, we mean sex, sexual health, anything that will affect people in the LGBTQ plus community and people of color. We have a wonderful show with a very special guest. But before we bring her on, my name is Kai Smith. I am program coordinator to our Healthy Him program. Hi, as you can see, I did my hair today because we have a guest. So I wanted to look nice, company today. So
you look like you showered. Good job.
Look.
Yeah.
What's up, everybody? I am your boy, Daniel J. It's good to be here on yet another episode of The Link.
Hi, everyone. It's Rogelio, program coordinator of Trans Connections. Update to the title, but yes, here.
Come on, promotion. And I am Ty, linkage to care extraordinaire for everything HIV. So nice to see you all today.
So as we said, we have a wonderful, special, amazing guest. I'm going to read a little information about her before I bring her on. But today's episode, Stick It In Me, is our conversation about the COVID-19 vaccine. You have questions, we have questions, so we brought a professional. So our guest was selected as a national finalist for the White House Fellows Program and completed the National Coalition Scholarship Program at UCLA with a Master in Science and Public Health and Management with an emphasis on implementation science from Fielding School of Public Health at UCLA. She is also now an associate professor in the Department of Health System Science at Kaiser Permanente Bernard J. Tyson School of Medicine. That is a big title.
So basically what you're saying is that she's amazing.
Look, this resume is impressive, and if I could read all this to everyone, but I want to welcome our very special guest, Dr. Etsemaye P. Agonafer, or as we like to call her, Etsemaye. Hi, welcome to The Link.
Hi, Kai. Hi, everyone. So wonderful to be here. Thank you for the warm introduction.
Well, thank you so much for being here. As we mentioned, you are here today to talk about the COVID-19 vaccine because we have some questions, and a lot of people do. But before we do, I'm going to open up the floor for you. Tell us who you are. Tell us what's on your mind, what's in your heart, what's in your soul right now.
Sure. I'm an internal medicine physician. I practice clinically at Twin Towers Correctional Facility, and I'm also, as you mentioned, an assistant professor at Kaiser Permanente School of Medicine. In addition to all of that, I do research focused on vulnerable populations. And lately, in the last year or so, I've been really focused on how do we communicate about this COVID virus and the upcoming vaccine. And so before we even get into sort of questions and concerns about COVID, I actually want to level set with you all because we need to take a moment and sort of just acknowledge how the COVID pandemic has really turned our entire world upside down. We all know this. People have fallen into illness. They've been hospitalized and some have recovered, but many didn't, right? We're at over 400,000 Americans that didn't, and we're mourning their losses. But on top of that, so many are working from home and trying to figure out how to do homeschool, juggle that with the family. And then there's even more that are, have lost jobs and trying to figure out how to keep food on the table and make sure that they still have shelter. So we're all sort of mourning the loss of what was normal, the plans that we had for our future. And while we sort of sit in this place of uncertainty, my hope today is that I can sort of shine light or bring clarity to some of the questions, concerns about the virus, the vaccine, and be as transparent as possible with you all, because, information is constantly changing as we're learning about this new virus. And I want to let you know when I don't know the answer too, because with this information, I think your audience and all of you can start to make, the decisions that are best for you as an individual, for your families, and your communities at large. And so I'm really looking forward to the questions you guys have for me.
Yeah, well, we're so thankful and grateful for you to actually take your time out to be here. You are busy, and we definitely recognize that. So for coming down and supporting us. So I guess the best thing that we should start with for the COVID-19 vaccine is, what is it? How does it work?
Yeah. Before I even jump into how the vaccine works, I think we got to do a little bit of biology 101 for the audience, right? And understand sort of a couple of things. And I'll give you an analogy towards the end.
Is there going to be math involved? Because I wasn't good at that.
No math, because I can't do it. I can't do it.
Got it.
So let's start with DNA. DNA is this component of every single living cell that essentially gets transcribed and becomes messenger RNA or mRNA. That mRNA gets translated to become a protein. And proteins are different components of cells that make it work. Bunch of words that probably don't make much sense, but let's use an analogy. Let's think about DNA as like a computer code or the code book to developing an app that a techie uses to develop something like Instagram, right? With that code book, you essentially create an app that a user like me, you, anybody else in this room uses to sort of upload a story to our Instagram page, right? So that story is the messenger RNA. And I use the Instagram story as an example because it's one that sort of disappears over a little bit of time, right? But it's also a visual or a protein that your friends and followers can either like, dislike, or leave alone, right? So the COVID vaccine is not a DNA vaccine. So it's not a code book that's going to change who you are, change your inside. We're not putting anything into you that's permanent. Instead, the COVID vaccine is a messenger RNA vaccine or an mRNA vaccine. Essentially, we're injecting a message into your body, just like an Instagram story, that's temporary. Teaches your body how to essentially create a protein that's on the surface of the COVID vaccine or the COVID virus itself. The protein's called the spike protein. Once that the injection creates the protein, your body and its immune response, your fighter cells, come in and take up that protein. And while it gets rid of that protein, it also starts to develop memory for your body, so that you essentially have antibodies that can come and attack that protein if you are exposed to it in the community. So it is in large a very new, innovative technology that everybody's like, oh my gosh, what kind of harm can this cause me? But it's actually a technology that's been developed since 1990s. And, in January of 2020, when we first learned about COVID, the scientists were able to look at its genetics to develop this vaccine. So they were taking a technology that's been developed over the past 20, 30 plus years and applied it to this pandemic that's wreaking havoc on our lives.
Wow. Thank you so much for that information. We actually had someone comment that said this was an easy to follow example. And I want to second that. I feel like the way you described it has been the least medical way that we've heard it. We've all sat in webinars and seminars about how to do it, and it was very mRNA proteins, and I was like, great, understanding the cell. So thank you so much for that really, really great breakdown of it. So we really appreciate it. And I want to pick out something that you had said, that this was taken from the 90s. So this is technology that it's over 30 years old. So what do you think is the reason why there's such a pushback for a lot of people on why they don't trust it?
Well, there's pushback with every vaccine, right? On an annual basis, folks come into my clinic and I'm trying to convince them to take the flu shot. How many in this room took the flu shot this year? Before COVID, right? Oh, well, okay. Daniel was like,
wasn't gonna catch me slipping.
But it is genuinely really difficult to get people to take vaccines. And on an annual basis with the flu vaccine, I probably get 40 to 50% of my entire patient panel to accept it. So there has been sort of, anti-vaxxers for a number of different reasons, whether it's I don't trust science, I'm a part of a community that's been tested on, or the flu shot or a vaccine gets me sick anyway, so why do I have to take it? And the positive piece to why people are saying, oh, I don't want it is because they've never had to be hospitalized with an illness related to a flu or a coronavirus. They've also been fortunate enough to never be in an ICU on a machine to help them breathe. They've also maybe not have been a family member that had to make a decision for somebody that was in that situation. And what breaks my heart is I've been exposed to those things. And so my job as a primary care doctor, when I'm trying to get people to take vaccines, is to try to expose them, try to give them some insight into this is a preventative measure to stop you from coming into my hospital. Because I really don't want to see any of y'all in the hospital, let alone on a ventilator. So with vaccines, generally, we have mistrust. We have mistrust in medicine generally, right? And I get that. And it's really, the hospital healthcare system, the academic institutions that really need to do work to build trust with communities and the people that we're trying to serve. That being said, why is there pushback on corona vaccine? All of this is new. I prefaced our conversation with this virus, this pandemic has flipped our world upside down. Like, in all honesty, a year and a half ago, we would have been in person doing this, right? And so we flipped our world upside down. And then all of a sudden, the institutions that we didn't trust are telling us we have a solution that's going to fix it. I think everyone has a right to question what's going on. The other piece that makes it challenging is that we're getting information from a million different places, right? And some of the information is reliable and some of it is not, right? And we don't have a good way to filter what's good and what's not. We have to make sure that we're in a bubble where you at least have somebody that's informed, with not fake news. And so, it's my pleasure here to come here today and try to demystify any questions folks have. I also realize that this can sometimes feel like me talking at you. And if we were in a room, we would have a dialogue and I would try to figure out why for Kai is it a problem for him to take the vaccine? Why is it for Rogelio a problem to take the vaccine? And I would meet you where you are so that we can make a decision together. At the end of the day, it's your choice, your body, and your life, but you have to also accept some of the consequences if you decide not to take the vaccine.
Yeah.
So I have a question based on being someone who does not get the flu vaccine, because I used to, and I am one of those people where I very rarely get sick throughout the year, and every time I have taken a flu vaccine, I have become severely ill. Like I'm out for like 7-8 days. Can't walk, my body ache, like it's the whole night. And so I'm just like, I'm not gonna do that. So my question is, because a lot of times when it comes to, especially now with COVID, these conversations surrounding vaccines, it's very much the same type of conversation that I hear as it pertains to like sexual health, where people who don't do certain things or don't or choose not to take these vaccines, they're kind of demonized in a way, as if to say, oh, you're out here being reckless, you're not taking care of yourself. So for people that do have an apprehension or a hesitation to taking vaccines, what are things that they can still do to protect themselves? Because I talk to a lot of people that feel like a vaccine is not a cure, and I can still take it and still get COVID, and still be at risk. Obviously, we understand that you would be at a much smaller risk. But what are there options for people who decide not to take the vaccine?
No, absolutely. And I want to first acknowledge that the reason why you don't want to take the flu vaccine is a common one, right? A lot of folks come to me and say, every year I get symptoms. And we can talk about that at another time as to why we still got to get you the flu shot. But to answer your primary question, a vaccine teaches your body how to fight an infection that's looming or pending, okay? And we all know that. When it comes to getting the COVID-19 vaccine, we still don't have any long-term data about whether or not it prevents the transmission of the virus. So if you were to be carrying it, you could definitely go into a space and spread it to your friends. So what I tell people that to choose not to get the vaccine, you're going to be doing the exact same thing that people that are getting the vaccine are doing. And that's what we've been telling you for the last year. physically distance, keep 6 feet apart, don't gather with large groups of people that you haven't been in your little bubble with. 2, continue to wear a mask because that's your biggest safeguard. And 3, wash your hands. You should have been washing your hands before all this.
Okay.
That part.
I mean, and I think it's everyone's right to say, I'm not ready to make this decision to get a vaccine. I'm not here to push that on anybody. If you choose not to get this vaccine, you still got to do those other 3 things that the people that are vaccinated are going to be doing too. And you know, it's hard, but those 3 things are hard, right? Because I want to hang out with my friends and family. The holidays were extremely hard for all of us. Is there an end in sight where we don't have to do those things? Well, it depends on if we get enough people to get vaccinated and we develop herd immunity, where a lot of people in our communities and our general population essentially won't get too sick. And that's what the vaccine does, right? The vaccine trains your body to attack a virus when it comes so that you don't end up in the hospital. You may be asymptomatic, but you won't end up in my hospital where right now in Los Angeles, I don't have enough oxygen for you. I don't have enough beds for you. There's some hospitals where there are people literally in the gift shop because there's no beds available. They have put beds in the gift shop so you can get care. Or worse, you know, you're dying alone or you're FaceTiming your family before you're gone. Like, these are terrible things. And so the vaccine can prevent you from getting to that sick. But the other 3 things, the distancing, the mask, and the washing of your hands is what's going to help you.
Right.
I have a question for you, Etsemaye. And one, I am getting my vaccine today, so you'd be very proud of me. So I have a question as it pertains to HIV. So often we hear about pre-existing conditions being part of the reason why people are on the bad end of COVID-19. We hear people recover from it, they get sick for a little bit, and then they're fine. And then we hear about people going into the hospital and having really, really bad experiences and being on a ventilator, like you said. As it pertains to HIV, is it easier to get it if you are HIV positive with a lower immune system? Or is it kind of just like going out just like everybody else, where it's kind of like, oh, you're kind of taking a chance just in general?
No, you're absolutely more compromised. Having HIV, depending on what your CD4 counts are, right, you are an immunocompromised person. And by the CDC's guidelines, there's a number of different types of people that are immunocompromised. Those with the diagnosis of HIV, cancer, transplants, genetic immunodeficiency. So you are in this category where you could, get very sick. Unfortunately, because this is a brand new virus that we're still learning about, I can't tell if you walk in the door if it's you that's going to get sicker versus the next person that walks through.
Right.
All of us are taking a risk, but those that are immunocompromised are especially at risk for ending up in the ICU and on a ventilator.
Got it. Thank you.
Thank you so much. And I do have a question. You had mentioned something called herd immunity. So I know I've been seeing it a lot on, TV and the news. So I think a lot of people might not quite understand what herd immunity is. Would you mind explaining that to us?
Sure. It's essentially a point in time where an entire population or community of people have reached the point where the spread is not as bad as it would be if nobody had any immunity. So giving the shot, so with the COVID vaccine, first and foremost, I should say that we don't fully understand how well it prevents the spread of the disease. It definitely prevents severe disease from happening. The hope is that it also helps prevent the spread. And when we have enough people that have been vaccinated, where they get the shot actually in their arm, we'll eventually get to the point where not the spread of the virus won't happen as quickly, and our healthcare systems won't get as overwhelmed. I don't know if that explains it, but.
So I know I've seen online, they've given a number of 70% of people who should probably be getting the vaccine for it to be effective. Is that something that you know as a fact, or is that still something that they're trying to figure out?
I think that they have done some modeling to determine how many people in our general population we need to vaccinate to get to herd immunity. But those numbers will shift over time as we learn more about the vaccine, as we sort of see what our rollout looks like, because we all know that's been a little bit of a mess across the country. I wasn't responsible for that. Yes, absolutely. It's everything when it pertains to this virus and to the vaccine is a moving target in terms of information. But when it comes to the vaccine, we should talk about efficacy of the vaccine at some point. But the data, the studies that have been done to understand how the ones that have been approved that exist is sort of the bottom line and how it works right now. There's no question there.
Very good. And we definitely will talk about efficacy, but when we come back, we're going to take a quick break, everybody. Don't go anywhere. We have the wonderful Etsemaye here, so stick with us.
Hey guys, Ty here from APLA Health, and I got some good news for you.
APLA Health is launching our first ever at-home HIV testing initiative.
As we battle the global pandemic of COVID-19 and all that it entails,
APLA Health is doing what we can to fill the gaps for those who are in need of knowing their status, linking to care, and having safer sex options.
The initiative, officially known as Swab and Chill, will be our virtual hub for those seeking to take an HIV test, receive HIV kits, link it to medical care for those who are HIV positive, while also having access to several other programs and services that specialize in harm reduction for HIV infection.
Such services include PrEP and PEP information, as well as substance abuse services. Our goal with Swab and Chill is to make HIV testing easily accessible and easy to use within the comfort of your own home.
We provide each client with the Aura Quick at-home testing kit. This kit is a simple test that is done by orally swabbing the gums and waiting 20 minutes for your results.
APLA staff is available to virtually assist you while taking the test, while providing resources and support for those who may test positive.
maybe you already know your status and you're just low on condoms and lube due to accessibility. No problem. We can also send you one of our safer sex kits right to your front door.
As we strive to keep our community safer and well informed, your privacy is also a high priority.
All packaging will appear from APLA Health. Our over-the-phone assessments are quick, easy, and secure, so you can feel safe in sharing your results with us and asking any questions that you may have.
If you or someone that you know is interested in having one of our at-home testing kits mailed to you, or you just want more information on what Swab and Chill can provide, please call one of our team members at 323-329-9713, or just email us.
Come swab and chill with 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 us.
Hi, come swab and chill with us. We have a little joke. We like to make fun of Rogelio in that video because they always we're just kind of pleading a little bit in that take for. So.
That was supposed to be cut out, but
it's the reason why people actually come and swab and chill with us because of Rogelio.
Well, it's also because we make it so accessible, right, Ty?
It's so easy.
We make it so accessible. So accessible.
But no, welcome back. Well, I know Kai's coordinating, but I did have a question for Etsemaye.
Yeah, this is it.
Yeah, so I did want to get a bit of clarification because I know one of the big concerns is that since this process happened so quickly, and since the vaccine was able to roll out in record time, there are concerns that maybe, they cut corners, or maybe, not all the steps were taken to assure that it was completely safe or effective. Can you reassure us of the steps that were taken, just to, assure people that it is, and all the steps were taken?
Yeah, no, absolutely. We found ourselves in a bit of a conundrum back in March of 2020. And because we shut down the country, a lot of scientists were around the globe were trying to figure out how to get this out quickly. And I mentioned to you guys earlier that the vaccine technology has been around for a long time, since the 1990s. So when this pandemic sort of hit, the US federal government essentially created Operation Warp Speed to make sure that not only did we have a safe and effective vaccine, but we got it quick enough so that we could get out of sort of our stay-at-home lockdown orders, depending on where you are in the country. No steps were skipped in that process, but instead the steps were sort of overlapped on. So every single medication vaccine goes through the same type of clinical trials. It's sort of like a 4-step process. Pre-clinical, they are testing the product on animals to see if it causes harm and if it's as effective. Phase 1, they take a smaller group of humans and test out the vaccine, try to figure out what the right dose is, see if there's any side effects that are troublesome. And then phase 2, they take on more people, in like the hundreds of people, and start to see even more, like, is this actually working? Does this have harmful side effects? And then phase 3 is where you have thousands of people that are put into what we call a double blinded placebo trial, where one group of people are given the vaccine and another group of people are not given the vaccine. They're given a placebo. And the scientists compare the two groups to see, if there was an effect, if there are side effects that are harmful. The 2 vaccines that have been approved have gone through all 4 of those phases. Because we needed the vaccine rapidly, the pharmaceutical companies, Pfizer and Moderna, filed for emergency use of these vaccines, and it was approved by the Food and Drug Administration. So, Rogelio, rest assured, it has gone through an extensive process, and over 70,000 people were tested in this process of this clinical trial to make sure that it works. And so we're at this point where these 2 vaccines sort of made it all the way through. We're rolling it out to the community. And these pharmaceutical companies are still studying the long-term impact of these vaccines, because we've already recognized that they're effective, at least in preventing severe illness.
Right.
Etsemaye, I had sorry.
Oh,
Dan,
I
you
was
want to
going
go?
to say, there was a question in the comments. We talked about this before we went live, but is there a difference between the Pfizer vaccine and the Moderna vaccine, and can you switch them up between the first and second dose?
No, that's an excellent question. And I should preface this with a bunch of different pharmaceutical companies, in addition to Pfizer and Moderna, are actively developing vaccines. It's that Moderna and Pfizer, they beat everybody else in terms of getting it out soon enough. There is technically a difference between the 2 vaccines. But the way they function is the same way that I described earlier, in that it's an mRNA vaccine that creates the spike protein. They are both about 95% effective. And if you compare that to the flu vaccine, which is only 40 to 60% effective, this technology is incredible, right, in terms of stopping severe illness. The other some similarities between the 2 are they're both a 2-dose vaccine. The difference is that Moderna, you get your first dose, and then 28 days later, you get your second dose. For Pfizer, you get your first dose, and you have to wait 21 days for your second dose. A difference between the 2, Moderna is approved for everyone that's 18 years old and older, and then Pfizer is approved for 16 years old and older. In terms of preference between the 2, there is absolutely no preference. Like I said, they're both equally as effective as each other. Unfortunately, because of the limited supply of both of the vaccines, you can't go into, your clinic or wherever you're going to get the shot and ask, I want Moderna versus Pfizer. That option is not available to you, but you have to make sure that your first dose, the brand is the same for the second dose. That's vitally important. But yeah.
Is there a reason for that? If that did not happen, what would the outcome be?
Well, honestly, it should happen 100% of the time, because when you get that second shot, they will ask you, what did you get the first time? And the reason why you want them to be the same is because it's the same sort of material inside of that vaccine, and switching it up has not been studied. We can't say that it's going to give you the same immune response that you need if you were to stay with one brand.
Mm-hmm. I have a question as well, and there is a question on the side that I do want to answer to, but a question from one of my clients as it pertains to the super strain. With the vaccine, will that assist you with fighting off that super strain that they're saying is more contagious than the original strain that we're dealing with, or do you feel like there'll be another rollout for something that'll address that?
The hope right now is that there isn't going to be another rollout of a vaccine that addresses the super strain or the other strains. It's normal for viruses to mutate. So we should expect this. The vaccines themselves are targeting the outer layer of the COVID virus. And I'm sure a lot of you guys have seen the picture of the big globe with a bunch of spikes coming out of it on different social media platforms or even on the news. The vaccine is targeting that outside spike protein. And no matter what mutations you have in the DNA that I described earlier, that the hope is that the vaccine continues to target that outside layer of the virus.
Nice. And then also one more question for you that I saw in the comments that I thought was very, very interesting comes from Portia. Hi, Portia. Portia will be a special guest on our upcoming In Bad episode, which I'm very excited about next month. It says, are all vaccines created using dead/deactivated cells of the virus is meant to vaccinate us from, or is that not all the way true? So I guess the question is, are we getting dead cells from a virus injected in us to protect us from further infection?
The answer is absolutely not. So this virus and many other viruses this is not a live active virus. As I mentioned earlier, it is the mRNA, that Instagram story that you post, that is a temporary message for your body to activate an immune response. There is no fetal tissue in the vaccine. There is no, there's just no tissue, no active virus or part of the virus. It is actually a message that creates a mimic of the outside of the virus so that the body can then respond if you're ever exposed to somebody that has it.
Thank you.
Rogelio, I know you had a couple questions in regards to people in the trans community getting the vaccine. Did you want to ask that?
For sure. So one of the biggest concerns for the trans community whenever anything medical comes up is, the risk of having to stop your hormones or worry about adverse side effects. So to your knowledge, do you know whether people who were on hormone replacement therapy were included in the studies? And would you still suggest that, it's as safe for them to take the vaccine? And also just generally, are there any people who should be, wary about taking the vaccine?
No, that's an excellent question, Rogelio. And there were really very little exclusion criteria for joining the vaccine trials, and those that were on hormone therapy were not excluded. So we should assume that this vaccine should work in the same way without any harmful effect on somebody that's on estrogen or testosterone or whatever the hormone is. Realizing that those hormones are natural parts of your body, and we're just injecting a message into your arm that will instruct your immune response to sort of activate. That being said, the pharmaceutical companies that have put out this vaccine are still studying the long-term side effects of the injection. And so I can't say with all certainty that there is no harm down the line, but there should not be any short-term side effects that we're aware of. And as information becomes more available, I'll be sure to share it with you all.
Great. So we have a couple questions from commenters who are watching the show. The first one is, what happens if you miss the second dose? How long do you have to wait before re-engaging? Are you able to just kind of go back, or do you have to start all over?
Yeah, the ideal situation is that you don't miss the second dose. There is a little bit of leeway in terms of how many days early or late that you can take it. So remember, that first injection is it like gets your infection army ready to go and ramped up. That second injection is a booster to make sure that you have all the memory in your system to make sure to attack the virus if you were to get in contact with somebody that's carrying it around. And so, ideally with Moderna, 28 days after you get that second shot. With Pfizer, 21 days you get that second shot. If the CDC guidelines say about 3 to 4 day leeway, and there really is no information about whether or not you have to start the whole series over. And we'll learn more about that as we sort of move forward.
So don't y'all miss that second day. You heard the lady. Don't you miss that second day. Okay?
So another question we got was someone was told that if you're asthmatic, you shouldn't take it. And we kind of got on this. I know for me, I have an EpiPen and I have severe food allergies. So I was also told maybe to be a little bit careful about the COVID vaccine. What information do you have about that?
Yeah, no, absolutely. So there, folks that have seasonal allergies, food allergies, or pet allergies, this vaccine is not known to be a problem for you. Those that have severe allergies, where you actually ended up in the hospital with swelling of your mouth, throat, ended up on a machine or something of that regard, you really need to talk to your doctor before getting this vaccine. You may also want to look at sort of the preservatives that are in the vaccine to determine if you have a known allergy related to the preservatives themselves. For those of us with asthma or other types of allergies, again, there's no contraindication to taking these vaccines. No matter what your status is, though, when you get the shot, there is a 15-minute monitoring period where a medical professional is making sure you don't have an allergic reaction. If you have a known history of a severe allergy and your doctor okays you, typically that 15 minutes becomes 30 minutes, and they really, make sure that nothing goes wrong. And if something goes wrong, they have the medication and equipment to make sure you get the care that you need.
Yes, you are not taking the shot at home with nobody around you. I understand that the allergies and all of that stuff becomes a big thing. You'd be surprised. A lot of people are like, at the end of the day, I have X, Y, and Z. So I don't feel like I want to get it, because if I get it, I'm going to go home. And that's when my allergic reaction is going to happen. As you all just heard, 15 minutes monitoring by a professional, and then also 30 plus minutes if you are in that window of a possible reaction and you are there where they can assist you. So I'm just trying to make sure that everybody understands it's not a big hoopla, like go and get this vaccine. I'm sorry. Go ahead.
So I have a 71-year-old mother who recently tested positive for COVID. She's also diabetic. So it's a big scare for us on that end. And so she was asking, with her having tested positive for COVID, kind of going through her quarantine period right now, would it be okay for her at her age with diabetes to get this vaccine, or would there be any kind of reactions that she would have to look and be aware of?
No, absolutely. And Daniel, I hope she's doing better now. I know that
she's doing better. I run a tight ship when it comes to my parents, so she's definitely doing better.
Good, because everybody, the folks that have caught it and recovered still have issues with it. But that being said, if you've had the coronavirus and you were outside of your quarantine window, there is no contraindication to getting the vaccine. Your own body, if you fought off the virus, has developed an immune response, but we don't know how good of an immune response that is. So your mom, within the 90 days after that infection and after they quarantined, she essentially, her body could fight off a second infection. But there have been people who have had a second bout with coronavirus. And so in those folks, the recommendation is you can get it after your quarantine, or you can wait the full 90 days to get your shots. And that should provide you with a higher level of immunity. That being said, your body has already developed some awareness of the spikes on the outside of the virus and has fought it off before, but this gives you added benefit. And for someone like your mother, who, you know, is what we call elderly, but I bet she's fly. But also we got to make sure that, you know, she's protected, because she's always going to be at risk.
Yeah.
So for anyone who is wondering, so you're even if you have had COVID before, you would definitely recommend getting the vaccine after that quarantine time period for better.
Yeah, after the quarantine time, most effective 90 days after.
And also, since you answered that question, I do want to ask you another question as well as it pertains to that. So I am recently getting into Twitter, and I'm noticing that people are still traveling, people are still at the clubs, people are still hanging out with their friends in open settings. What would you say? I don't want to talk about Atlanta because we might have some Atlanta people watching, but Atlanta gay Twitter is hot right now. What would you say to those people that don't feel like it's that big of a deal? I've seen a lot of people take Tulum trips and all kinds of trips as if we're not in the middle, in the eye of the storm of a pandemic. So since they don't listen to us, maybe they'll listen to you. What would you say to those people that do not understand that quarantining and self-isolation right now is extremely important?
It's hard. I understand how hard it is to stay home and be isolated and not do the things that you love. But it's, like I mentioned earlier to you all, like, folks just don't know what it's like to be in the hospital. And, you know, we're fortunate as a society that a lot of us don't end up there. But it's about sort of considering your community at large. And not only protecting yourself from getting sick, but making sure your brothers and your sisters aren't going to get sick either. You know, I'm jealous of those guys that are traveling and having fun, but I'm also super worried about them. And I would hate for, you know, my friends and colleagues to have to care for them and call their family members to make sure, you know, that they're providing the care that that person would have wanted. And it's not fun to die alone. And I also don't want to scare everybody into, you know, getting this vaccine and, you know, physically distancing, wearing a mask, and washing your hands. But it's about compassion for the community that you're a part of. And if we can't start to appeal to to their heart, to the love of self and the love of others, I don't think that there's any science or words that I could use that can convince folks otherwise.
Yeah, I think that you said it very well, because I would say stay that ass home. Stay home. Let us get this vaccine. Let it do what it needs to do, and let's not put anyone at risk. My favorite word is no. So no, I will not be joining you for anything in the public.
I'm glad you say no. I mean, we need more people to say no.
Sometimes I just shake my head. Sometimes it's not even a word. I just like, no.
Yeah. We also got to acknowledge the other side too, and why is it that they are so adamant about doing it is that they want to do. We can't villainize folks for their choices. We can make sure that they're informed. Maybe my field has not done a good job of informing folks that feel that they need to go to the club before. You know,
y'all come on the same time every single day. Y'all doing a great job. If people don't want to listen, y'all doing fantastic. Y'all come on the same time.
On the flip side of that, I have what do you say to people who are on the other end of the spectrum, where they're just super paranoid, super just like, I'm not going to the store even though I need toilet paper. Like, I've known people that have really just been debilitated from this whole pandemic. Like, they're afraid to answer their phone because they feel like it's gonna come at them in the phone. Like, what is your advice to those people who are just overly paranoid and feel like life just stops because we're in this pandemic?
I genuinely understand both sides of the spectrum. Those that just want to go out and those that just want to stay in a box so that nothing touches them and they can live their lives to the fullest. The only thing that we have against this virus since March was the physical distancing, wearing the mask, washing our hands. Now we have a vaccine. So we have 4 things in our tool belt to take care of this thing. It's important for you to also go outside and get some sun. Wear that mask though, and keep your distance. It's also important for you to go to the store and, make sure you're eating well, because, there's other things outside of this virus that can kill you. And that's sort of what I alluded to when we first started our conversation, is this virus, this pandemic is affecting people in a number of ways. You either get really sick with it, and you end up in the hospital, or you're dealing with the consequences of your job being shut down and you're not able to pay for food, or you're just terrified of getting it and you socially isolated, become really depressed, alone, and you don't even realize it. And so I guess my job as a medical provider, a researcher, somebody that's trying to amplify the voice of public health, is to meet folks where they are. I think we need to do a better job of trying to understand why it is that someone doesn't care about this at all versus why someone cares so much that they're debilitated, and then try to sort of personalize the approach. I can't give you a blanket statement in terms of what we need to do for that particular person. But we should acknowledge it as real. It's a real feeling. And it might be a form of miscommunication too, right? Like misunderstanding the severity of this and how to protect yourself against the virus.
Great. Well, thank you. So we have one more question that someone put in the comments I thought was really important. And then we're going to actually go on to our last section of What's Popping, because we want to get your take on what's happening in the world. But this question is, rumor has it that hospitals are throwing away unused vials of vaccine if people don't show up to get vaccinated. Can you explain why that's maybe occurring? And once the vaccine thaws, is there a time frame for its use?
So it's a complicated question. So when the vaccine is dispensed by the pharmaceutical company, it's essentially put into a vial. Nurses, whoever's injecting the vaccine, will pull out some of the vaccine into a needle, and based off the dose that's required, give it to a patient. Sometimes there's a little bit of extra vaccine in the vial that could be considered as waste. In no way, shape, or form are healthcare systems wasting material. I think that everybody is doing their best to make sure that they are vaccinating those people based off of the tiered approach that different counties, states have implemented across the country. I don't know if that answers your question, Kai, but it's really just about how you administer a medication and how there's a little bit left over. We're trying not to waste it. We know there's a shortage, and we're hopefully after tomorrow we'll have a little bit more vaccine available for people.
After tomorrow, yes.
After tomorrow.
After the events tomorrow, absolutely.
And that is actually a great segue to our next little section, our last little section with the special guest. What's poppin'? Our social commentary on the world. So we let you know kind of estimate what this is, come with your pop culture reference or anything happening in the world. Is there anything going on right now that you have just been thinking about or worried? I know you mentioned tomorrow, but is that something that's really big?
Well, tomorrow is on everybody's mind. This last year has been a mess, not just because of this pandemic, but really an awakening in our society about things that all of us in this room know have existed for a really long time. And so tomorrow, with the inauguration of President-elect Biden and Vice President-elect Harris, I'm hopeful. I'm hopeful for what comes next. But I mean, to not make things too serious, because I thought this was supposed to be fun, I've been immersed in TikTok lately. And that's kind of how I've escaped the world, is watching people's videos. My sister taught me how to make videos but I haven't posted any publicly.
I
But
still don't know how to use it. I have no idea how to use TikTok.
it is so fun.
Complicated.
Okay, I need to get into that then.
Those little kids are gonna roast me. I'm not interested.
So as a person who is on TikTok, TikTok is not for the young ones anymore. Okay, it is all ages. Trust me, there are 65-year-olds out there with huge followings on TikTok for what they post and how they post.
Okay.
So you
You won't
definitely
catch
can get on and have a blast.
Okay.
I won't be doing the busted challenge anytime soon. But every out there you go for it.
I got bad knees. I can't do it.
Not happening for me. One thing I saw that's been kind of really going on, and it kind of relates to the inauguration politics. Yesterday, our current impeached president released, I guess, I don't even know what to call it, his own version of history called the 76 Papers. In this, it's 45 pages, or it's 20 pages, and then the last 20 pages is the U.S. Constitution. In this document, there are some very strange claims, but ultimately he says the founding fathers, what they did with slavery was kind of okay. That was fine. There was also a statement that really stuck out to me that, pro-life people really had changed America for the better, and activism and the push for social change is a form of fascism. So I wouldn't recommend reading. But
it's a waste of time. Absolutely do not read this comic book that this man created in his head that does not exist. I read it and I was disgusted at what I read. I just want him to go away. Like, go to Florida. Like, stay there.
He's going there. But for me, reading it this morning, like in my bed with like my little warm tea, and just like, what kind of history book nonsense is this? So if anyone is interested in the 1776 papers, I'm just going to say it's not worth your time and or effort to read. They straight up said slavery was fine and justified. And this was historians that this impeached president used to write this. So interesting for me to read this morning.
I think you told us all we need to hear about that.
Absolutely. I think that my what's popping would be Jasmine Sullivan just announced that she will be performing the national anthem at this year's Super Bowl. If everybody has watched previous episodes, we stand for Miss Sullivan. We are excited to hear all of them run. She'll do a lot better than Fergie did. And also that same day, and that's no slight to Fergie, just didn't sound good. That's and also that same day, her will be doing America the Beautiful. So we get a her performance and a Jasmine Sullivan performance for people who just watch Super Bowl for the performances.
Yeah, I'm not watching.
Beautiful.
No.
I'm watching for performances and commercials.
And the commercials, yes. It's going to be interesting to see the commercials now with everything, being centered around COVID and stuff like that. They're definitely going to try to do these really super duper dramatic commercials. So it's going to be really interesting to see.
Right.
Well, in other news, in entertainment pop culture, so the conversation about Miss Lori Harvey is still circulating, and people are doing a lot of talk about her escapades of relationship. And there was an article that was put out that actually tracked her entire relationship record of 2020 and started to name all of the men that she dated.
Did they do that? Did they do that for Michael B. Jordan? Did they do that for Michael B. Jordan as well?
And so the conversation has been, why are we still in a world where we now have women who are taking agency of their body, agency of who they date and who they have sex with? Why is it still so taboo for a woman to do and express and adventure the way that rich white men have been doing it for eons and decades and millennia?
Men in general, not just the rich white, men in general, all of them.
But I personally, I just want to say to Lori, despite what people's personal opinions are, I give it to the girl for being what I think she's like, 24, 25, somewhere around there. And I'm just all for you living your life. Like, live your life, experience, adventure, do what you need to do. And if somebody, wants to reciprocate with a coin, honey, that's your business. Go handle that. Because guess what? Flights aren't free.
That's very true. Also, I'm thinking how traumatizing that would be if someone chronicalized all of my previous relationship. One, I would sit there and be like,
Baby.
oh, I did date him, didn't I? Yeah, that's
Relationships, hookups,
80% of them. Yeah.
Baby,
Sorry.
I, for one, was a
That
bit
would be
upset just because, you know, when Michael and I agreed to open up a relationship, we agreed not to take it public, but, you know, he was seen with Lori Harvey, so he couldn't, you know, really help that. But anyway, I'm happy for them.
who
They're
that
both
was
beautiful
on the
people. No, but seriously, I think that they're both just like gorgeous people, and I don't know why people are so like up in arms about it. It's like, of course they're together, and it doesn't even have to be a big deal. Doesn't mean they're gonna get married. They might be dating new people by the end of the year, by the end of the month. Like, it's just a thing. I don't know why people are up in arms about it.
People all on social media flirting and getting new boyfriends left and right. They're engaged one week, they got a new girl the next week, and next thing you know, they're celibate or whatever. Like, everyone's so focused on who everyone else is sleeping with.
Blame the quarantine. I have seen people go from being extremely sexual liberating to I am celibate, and that's your business. That's your business. I think that, like I stated before, as it pertains to the media and Instagram, we see so many things in such a short amount of time. We see a new relationship, someone passed away, COVID-19 update, another new relationship, all of my haters. I don't know who those people are, but it's like, I don't believe that society should be putting on Lori Harvey that you dated X amount of people, because the same people that are writing these articles have had relationships that have failed. And you don't know what those relationships were like for her. Some of them could have been traumatic. Her dating Michael B. Jordan could be her finally getting over something, and to see people in the see people in the media kind of like bash her for that. We're in 2021. It's starting to get old. Like, please leave the girl alone. Let her do her thing. Y'all just mad because Michael B. Jordan ain't want y'all.
Right. And then we always talk about like everyone living their best life, having fun. You're in your 20s. What are you supposed to do? Date.
Exactly.
And it's always funny to me because, you know, we're really talking about Lori Harvey, but no one's mentioned, you know, my favorite white woman of color, Miss Ariana Grande, on Marriage Proposal #2.
Right.
We talked about how beautiful that ring was, though, but, you know, not the fact that she has had a really not healthy string of kind of relationships. But
I'm still waiting for Ariana to snatch that ponytail out of her head. I'm tired of it. Throw it in the trash.
She gonna hit y'all with a low cut and then drop a rap album. Watch.
I want a vibe, honey. I want a vibe. Blunt cut vibe is what I want.
The thing that frustrates me with her is that not a single one of those men has been attractive, and I'm just like, Ari, you are gorgeous. You need to get it together.
She has a type.
We don't know what she looks like without that makeup, honey.
But we are coming to the end of another episode of The Link. Before we go, Etsemaye, I want to give you another moment to, you know, say any last words, parting information, or just where you're willing people can reach out and find you.
Yeah, no, absolutely. Again, thank you all for this opportunity to share sort of my expertise. I hope I was helpful to the folks that are listening. My main message is keep wearing your mask, physically distance, and wash your hands. And if you feel inclined to get the vaccine based off of the information I shared, by all means, go for it. I will make sure to share some CDC guidelines with you all so that it could be shared with the larger audience. And I'll give you guys my contact information if you have questions that I can answer for you. I'm available for whoever has a question.
Thank you. And then once we get that information for everyone watching, we will share it to this video. So if you have any further questions, keep an eye out on this video. We will edit it with the information there. So with that, thank you again. We cannot
thank you so much.
Having you absolutely. You had fun.
I love this. Let me know if you have any other questions. If you need me back, I'm here.
Oh, don't say that because we will bring you back.
Yeah, absolutely.
Everyone says thank you. Have a wonderful, wonderful, safe day. Everyone out there, wear a mask, wash your hands. The doctor said it, so you got to listen to it. And we will see you all next week. Bye, everybody.
Rogelio, let's go get this shot.
Right. Put it in us. Put it in us.